Welcome to this educational program. This module discusses the evaluation of a condition of the prostate called Benign Prostatic Hyperplasia, or BPH for short. Other modules are available that describe other aspects of BPH. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. The prostate is a chestnut-sized gland situated at the bottom of the urinary bladder, the place where urine is stored. It surrounds a portion of the urethra, the tube that carries urine from the bladder out through the penis. The prostate gland secretes a thin, milky fluid that nourishes and helps activate sperm cells. A man's prostate enlarges as he ages. This common, non-cancerous enlargement of the prostate is called benign prostatic hyperplasia, or BPH for short. The growing prostate can cause trouble when it tightens around the urethra, obstructing urine flow, impairing bladder emptying, and causing dribbling after urination. It can also cause frequent, urgent urination, as well as bothersome nighttime urination. BPH is not life-threatening, but it can be embarrassing, inconvenient, and uncomfortable, significantly impacting one's quality of life. Someone with BPH may feel the need to urinate often or suddenly, or experience disrupted sleep due to frequent urination at night. He may strain to begin urinating, or may urinate with a weak stream, and have difficulty completely emptying the bladder. He may even notice leakage or dribbling of urine. Together, these symptoms are referred to as lower urinary tract symptoms, or LUTS. When left untreated, BPH can lead to a total inability to urinate called acute urinary retention, blood in the urine, bladder damage, bladder stones, urinary tract infection, requirement for catheterization or the insertion of a tube into the penis, requirement for surgery, and even kidney damage. You should see your doctor if you have any bothersome urinary symptoms, and see your doctor quickly if you have blood in the urine, painful urination, or if you are unable to urinate. Prostate enlargement, or BPH, is usually diagnosed based on urinary symptoms and the finding of a large prostate on examination. Urinary symptoms may be further evaluated using questionnaires, and simple lab tests are done to rule out other problems. All of this is discussed further in the next few slides. Your doctor will likely ask you about your health, any medication you are on, your diet and fluid intake, as well as your urinary symptoms, including how often you void, if you have hesitant, frequent, urgent, or painful urination, if you have a sense of not emptying your bladder completely, or if there is blood in the urine. The International Prostate Symptom Score, or IPSS for short, is a questionnaire designed to determine the seriousness of your urinary problems. The IPSS questionnaire will ask you how many times in the last month have you experienced certain symptoms. Answering these questions allows your doctor to quantify the severity of your symptoms, to monitor them, and to follow the effects of treatment. How frequently you experience each symptom is rated on a scale of 0 to 5, from 0 meaning not at all, to 5 meaning almost always. The answers for each question are then added together to give an overall score. An overall score of 0 to 7 means that your condition is mild. A score of 8 to 19 is moderate, and a score of 20 to 35 is considered severe. It is important for your doctor to understand how your urinary symptoms are affecting your life. Therefore, frequently combined with the IPSS is a tool called a quality of life scale. This is a question that reads as follows. If you were to spend the rest of your life with your urinary condition just the way it is now, how would you feel about that? Physical examination is an important way to evaluate the prostate. Along with a general assessment, your doctor will likely perform a digital rectal exam, or DRE. This allows your doctor to feel your prostate gland to get a better idea of its size and condition. The doctor inserts a lubricated, gloved finger into your rectum and feels the part of the prostate that sits next to the rectum. He or she will take note of the size of the gland and be sure that it feels healthy without any lumps. Your doctor may ask you to provide a urine sample for urinalysis, the testing of urine with a dipstick or microscope for various cells, proteins, sugar, and blood. Certain substances found in the urine may indicate disease or infection. The prostate gland secretes certain proteins called enzymes, one of which is called prostate-specific antigen, or PSA. PSA leaks out from the prostate into the blood, where it can be measured by a blood test. A blood test showing elevated PSA levels may indicate an abnormal condition of the prostate gland, such as BPH. A post-void residual test, or PVR test, measures the amount of urine remaining in the bladder after urination. After we urinate, we may still have a little bit of urine left in the bladder, which is normal. Too much residual urine, however, may indicate a blockage of urine flow. There are two ways to measure how much urine is left in the bladder. A doctor or nurse can drain any remaining urine using a catheter, or he or she can use an ultrasound to visualize the bladder and measure the amount of urine remaining. There are no strict cutoffs as to what defines an abnormal residual urine volume. However, most people would normally retain less than 50 mL. Sometimes, nervousness and stress can affect the results of this PVR, so the test may need to be repeated. Sometimes helpful in the workup of BPH is ultrasound, which uses high-frequency sound waves to produce images of the inside of one's body. For an abdominal ultrasound, a device called a transducer is moved across your abdomen to show a picture of its contents. In particular, your kidneys and bladder are evaluated closely. If there are concerns about your prostate condition, you may be referred to a urologist, a surgeon who specializes in problems of the urinary tract and male reproductive system. Like your family doctor, a urologist will begin with a medical history, physical examination, and lab work. If required, however, he or she may also perform special testing, such as prostate ultrasound, cystoscopy, and urodynamic studies. Prostate ultrasound, also called transrectal ultrasound, is rarely done for BPH, but may be required in special circumstances. For this test, a probe is inserted into the rectum to take photos of the prostate and display the images on a screen. The size of the prostate can be measured, and abnormalities of the prostate can sometimes be detected. A cystoscopy is a procedure that uses a small flexible telescope with a lens and a light to view the urethra, the prostate, and the bladder. The doctor will first numb the urethra or urine channel inside your penis with an anesthetic jelly, and then insert a small flexible telescope into the urethra. The images from the scope are usually displayed on a video screen, allowing the doctor to determine the size of your prostate gland and to rule out any other problems in the urethra or the bladder. A urologist may also ask you to urinate into a special device called a uroflowmeter, which measures how quickly your urine is flowing. A slow urine flow may suggest an enlarged prostate. A more advanced way of determining if your bladder is obstructed by your prostate is with a test called Urodynamic Studies. Part of this test, called the pressure flow study, simultaneously measures urine flow and pressure in the bladder during urination. Since obstruction of the urinary tract is characterized by high pressure and low flow, the pressure flow study can help confirm a diagnosis of obstruction caused by BPH. The complete urodynamic test is discussed in detail in a separate module. Simply put, this test involves inserting a catheter, which is a long flexible tube, through your urethra and into the bladder. Water will be slowly run through the catheter into your bladder. Then, while you urinate, equipment will measure the flow rate and the pressure in your bladder. The procedure takes about 30 minutes to complete. In summary, BPH is a non-cancerous condition where the prostate becomes enlarged. It is usually diagnosed by medical history and rectal examination alone. In certain circumstances, special tests are necessary for further assessment. Surgical specialists, called urologists, are often involved in the diagnosis and treatment of BPH. These references were used to assist development of this presentation. These resources have also been used to develop this presentation and/or may be accessed for further information. We hope that this program has furthered your understanding of diagnosing BPH. We wish you the best for the future, and thank you once again for viewing this educational program.